Good morning, everyone. I'm Raviraj Chaudhary, and I'll be taking a demo class for you guys on the topic of diabetes mellitus. So, basically, diabetes mellitus is known as Madhumeh in Hindi, and it is also known as metabolic disorder, metabolic disorder, and autoimmune disorder. Now, we'll study introduction or definition. Diabetes mellitus is also known as hyperglycemia. Hyper means increased, and glycemia means blood glucose level. Combined, it is known as increased blood glucose level in the body, known as hyperglycemia, or you can call it as diabetes mellitus. So now we'll go for normal values. See, for fasting, it can go up to 90 to 100 or 110 mg per dl. It is for normal value. Pre-diabetic, pre means before, and before diabetic stage, the patient value will be up to 126 mg per dl, and in diabetic patient it will be more than 126 mg per dl. These all are fasting. These all are fasting blood normal values. Now, after fasting means before having any meal or in the early morning. After meal, after 2 hours of taking meal, for normal 120 mg per dl. For pre-diabetic patient, it will be 140 to 180 mg per dl, and for diabetic patient it will be more than or equal to 200 mg per dl. So we have studied about introduction or definition. Definition is, it is also known as hyperglycemia. Hyper means increased, glycemia means blood glucose level. Combined increased blood glucose level in the body known as diabetes mellitus. Normal values for fasting blood sugar, it is normal up to 90 to 100 or 100 mg per dl. Pre-diabetic means before the onset of diabetes in the body, it up to 126 mg per dl, and in diabetic patient, it is more than 126 mg per dl. After having meal, 2 hour of taking meal, for normal it is 120 mg per dl. Pre-diabetic stage 140 to 180, it can go up to 140 mg per dl. It is normal. Pre-diabetic 140 to 180 mg per dl, and for diabetic patient it's more than 200 mg per dl. So we have studied about definition or introduction and what are other names of diabetes mellitus, also known as metabolic and autoimmune disorder. Now second point, we'll go for etiology. Etiology. The first point will be heredity. Heredity means comes from parent to the to their offspring or child. Heredity. Second one is your lifestyle. Lifestyle is what? Increased sugar taking substances on regular basis. Third one is obesity. Then fourth one is autoimmunity. Autoimmunity means when our own body, own body antibodies destroy or destruct our own body cell, thinking that it is a foreign material. Okay, it is also known as autoimmunity. Then fifth one is your heredity, lifestyle, obesity, autoimmunity. Then fifth one is your any surgical process. For example, removal of total pancreas, because pancreas is the gland which releases insulin by through beta cell, also known as isolate of Langerhans, which is usually maintain our blood sugar level. Now, heredity, lifestyle, obesity, autoimmunity, surgery. Okay, these are the etiology for the diabetes mellitus. One point we can find gravida, gestation only for women. Gestation means when the mother becomes pregnant. Now next we'll go for clinical manifestation. Clinical manifestation also known as sign and symptoms. There are plenty of signs and symptoms of a diabetic patient, but we'll study mainly three symptoms, which is also known as 3P's sign. 3P signs means first is your polyuria, second one is your polydipsia, and third one is your polyphagia. Polyuria means increased urine, polydipsia means increased thirst, and polyphagia means increased hunger. These are the three main clinical manifestations you will be seeing in the diabetic patient. So we have studied introduction, definition, then causes or etiology you can say, then next clinical manifestation or sign and symptoms. Then next is diagnosis. Diagnosis of the disease. See, for diagnosis, how we can diagnose a diabetic patient? We can diagnose through GTT. GTT also known as glucose tolerance test, in which we are giving 75 gram of oral glucose to a patient, and we'll be checking the blood sugar after 2 hours. If it is more than 140 or if it is more than 200 mg per dl, it means the patient is in the pre-diabetic stage or in the diabetic stage. Then second one we can use as HbA1c. HbA1c means hemoglycosylated hemoglobin. HbA1c shows us the past 3 month blood sugar level in the body. Its normal value Up to 5.7 it is normal. From 5.7 to 6.4 pre-diabetic stage, and more than 6.4 known as diabetic patient. So these two tests we can mainly go for GTT and HbA1c test in the diagnosis criteria. Now further, we'll go for types of diabetes mellitus. So there are mainly four types. I'll be taking a class for a very short period. Okay. So I'll be discussing very superficially. See, first type 1. Type 1 is also known as insulin dependent diabetes mellitus, or also known as juvenile diabetes mellitus. Insulin dependent diabetes mellitus or juvenile diabetes mellitus, known as, it is mostly occurring in the children's when there is absolute deficiency of insulin. That's why we are calling it as insulin dependent. Example, in autoimmune disorder, the our own body antibodies attack beta cell of Langerhans in the pancreas, and there will be no insulin production in our body. So there will be no maintenance of the blood glucose level in our body. So we required external. So hence we required external insulin for lifetime. For lifetime. That's why we are calling it as insulin dependent, because our body is always dependent in the external insulin. Now type 2. Type 2 is mostly 90% occurring diabetes mellitus in the adult. In the adult, which we can treat it by OHA. OHA means oral hypoglycemic agent, or through insulin. Insulin. The causes I have taught you previously, through hereditary or through by any surgeries or by any medicines. Then type 3. Type 3 is also known as secondary diabetes mellitus. It is mainly because of the surgery, removal of fully pancreas. If there is no pancreas in the body, there will be no beta cells and there will be no insulin. Hence, the body require insulin from the external sources. And second one is your medicines. Medicine, mostly phentoin. Phentoin is a drug which is using for a epilepsy. So this medication, what this is doing is increase the blood glucose level, causes hyperglycemia in our body. This is known as type 3 or secondary diabetes. And the last one is type 4. Type 4 is also known as gestational diabetes mellitus. In gestational diabetes mellitus, it is mostly occurring in 20 to 24 weeks when the mother is pregnant, because of the hormonal changes. The mother is in hyperinsulinemia and the mother is in hyperglycemic stage. Now, these are the type 1, type 2, type 3 and type 4. I have shown you the exact pathophysiology of type 1 also, because there is a destruction of beta cells because of the autoimmunity. Hence, there will be no beta cells and no insulin forming in our body. Hence, we need external insulin. Then type 2, we can treat it by OHA or insulin. Type 3 diabetes mellitus and type 4 diabetes mellitus. Now we can go for management. For management, there will be two types. First is your insulin, and then second one is your OHA. OHA means oral hypoglycemic agent. In insulin, there are four types. First is your short acting, which is known as Lispro. Then second one is your rapid acting, which is also known as regular insulin. Third one is your intermediate, which is known as NPH, and fourth one is your long acting, which we are using Lantus. Okay. So an OHA oral hypoglycemic agent in comes under metformin, hydrochloride, or glimepiride. So these were the management of diabetes mellitus. And for complications, so these are the types of insulin which we are using clinically, and OHA, metformin, and glimepiride. There are plenty of drugs which we are using, which we will study in the pharmacology. Then last one is your complications. As our body is in hyperglycemic stage and the sugar is very high, so there will be more chances of infection. The foremost thing we are caring of hyperglycemic patient is taking care of infection. Infection, then diabetic foot, diabetic retinopathy, diabetic nephropathy. So these are the complications of diabetes mellitus. First is infection, diabetic foot, diabetic retinopathy related to eyes, and diabetic foot. If will not treat efficiently, then we can then the patient has to amputate the part. So these are the basics of diabetes mellitus. We have studies introduction, definition, sign and symptoms, then causes, etiology, then pathophysiology in the types, then management and complications. So I hope you guys understood. And if you have any doubt, please reach to me. I'll be very happy to convey the message. Thank you.